Obstetric Examination. The obstetric examination is a type of abdominal examination performed in pregnancy. This video provides an introduction on how to conduct an obstetric examination. Maternal pelvis. The bony pelvis is made up of two innominate bones, the right and left hip bones, which consists the fused elements of the ilium, ischium and pubis, the sacrum and the coccyx. The pelvis may be divided by linea terminalis into an upper part known as pelvis major or false pelvis and a lower part known as pelvis minor or true pelvis. The true pelvis is divided into inlet, mid-cavity and outlet. Classification of pelvis. There are 4 types of maternal pelvis based on the inlet or shape of the pelvis, namely gynecoid, android, anthropoid and platypaloid. Terminologies used to describe a fetus in relation to the uterus. Engagement. Engagement is the passage of the widest diameter of the presenting part to a level below the plane of the pelvic inlet. In a cephalic presentation, this would refer to the biparietal diameter. It is generally measured as fifths palpable above the pelvic brim, and the head is said to be engaged if 3 or more fifths are past the pelvic inlet. Lie. Lie is the long axis of the fetus in relation to the long axis of the mother. Fetal lie can be longitudinal, oblique or transverse. Presentation. Presentation is the leading part of the fetus that directly overlies the pelvic inlet. It is usually cephalic, breech or shoulder. Types of breech presentation. Breech presentation includes complete breech, where buttocks and both feet are presenting, with legs flexed at hips and knees, or incomplete breech, which can be an extended breech, kneeling breech or footling breech. Attitude. Attitude refers to the posture or relation of various parts of the fetal body to another. It may be flexed or deflexed. The normal attitude is flexion. Denominator. Denominator is a bony landmark on the presenting part used to denote the position. Position. Position refers to the position of the denominator in relation to the maternal pelvis. For example, in vertex presentation, it can be occipito-anterior, occipito-posterior, or occipito-transverse. If the fetal spine is on the maternal left, it is further specified as left occipito-anterior. Synclitism is the position of midline sagittal suture in relation to the maternal pelvis. Synclitism occurs when the 2 parietal bones are at the same level and the sagittal suture is at the midline. The fetal position is called asynclitic when one of the parietal bones is presenting and the sagittal suture is to the left or right rather than to the midline. Obstetric examination. When the patient presents to the labor ward, perform the general examination. Then ensure bladder is empty and perform the obstetric examination. Examination of a pregnant woman is carried out with the examiner standing to the right side of the woman. During the examination, inspect for linea nigra, stria gravidarum, and presence of any surgical scars. Palpation of gravid uterus. Conducted from 28 weeks onwards, this is a palpation examination done to measure the symphysial fundal height. Symphysial fundal height is the distance from the pubic bone to the top of the uterus. The doctor should take note of any uterine contractions, its frequency, duration and strength, as well as any fetal movements and fetal heart rate through Doptone fetal monitoring or cardiotocography. The palpation of gravid uterus is done in 4 steps. Step 1. Determination of uterine size. The highest point of uterine fundus is located by moving the left palm from the right costal edge downwards until the radial border of the palm meets the first point of resistance. The upper border of symphysis pubis is then determined. Symphysial fundal height is then measured by using a tape from upper border of symphysis pubis to uterine fundus. In general, from 16 to 36 weeks, the measured symphysial fundal height in centimeters corresponds to gestational age in weeks, give or take 2 weeks. Step 2. Pelvic grips. 1. Fundal grip. This step is the palpation of fundal area with both palms for fetal parts to identify which pole of the fetus occupies the fundus. For example, broad, irregular, firm fetal parts in upper pole indicates buttocks, confirming cephalic presentation in lower pole. 2. Lateral grips. Stabilizing one side of the uterus with one palm, palpate the opposite side with the other palm and vice versa. This step helps in determining the fetal lie, the fetal back and the approximate fetal size. This also helps to determine approximate liquor volume. Step 3. Palpation of degree of engagement by moving palms towards pelvic brim to ascertain if presenting part is engaged or not. To confirm the presenting part, examiner faces mother's feet, placing both hands on either side of lower part of uterus just above the symphysis pubis and pressing gently inwards to feel the presenting part between both palms. Vaginal examination during labor. Perform a sterile speculum vaginal examination, particularly in cases of vaginal bleeding or leaking. Only gentle per speculum examination should be performed if placental location is unknown, and bimanual examination should not be performed in such cases. Look for pooling and color of liquor, any foul-smelling vaginal discharge, bleeding and source of bleeding in any local cervical or vaginal lesions or polyps. Check if bleeding is coming from cervical os and the amount of bleeding. Check if cervical os is open and if membranes can be seen. During the vaginal examination, take note of the following: dilatation, cervix effacement, membranes, position, station, caput, and molding. Thank you for watching this video. This video is presented by Yonglu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.